go through the hip spica. But usually with the hip spica, there could also be a muscle strain. Okay, so the issues with the hip could be pure to the hip. They could have pinched the hip, they were running, they twisted, they cut, they created an impingement. Now they're having pain lifting their leg up, okay? That could be solely to the hip. Or they could have a high adductor strain, a high rec fem strain, a high hamstring strain that also is limiting the ability to lift or run or cut or twist. So that can go at the same time. So I'm going to show you, for the sake of time, how we do the unload with the spica, knowing you can separate those out. You can do just a thigh wrap with an unload. You could do just a hip spica. You could do an unload with a hip spica. Okay, so we've got a lot of options in this area. It really depends where the injury is. So let's say, for the sake of our injury, you guys might need to come this way, that let's just say she's got, let's say it's a high rec fem strain. Okay, so right here she has pain. She tells you that's the spot. You're going to identify how far above and below that it goes, and that is what I'm going to unload. Now these strains can be anywhere. They can be here, here, wherever they felt the pull. Okay, mid-belly hamstring. You have to just get X marks the spot, and that's what you're going to unload. Okay, so if this athlete is injured, they've either called a medical timeout, or the athlete has come off the court or field, and you are now taking the time on the sideline or in the locker room to tape them up. You would spray. Okay, we're going to put coverall. This one roll, you gave me a bad roll out of the box.
Might be.
Okay, there we go. I'm going to just make sure that that's covered. We go through the same exact technique as we just did, except now with the thigh, we have more muscle, more tissue. So now I'm using full pieces, strips here for my anchors, okay?
What if your athlete has like a huge leg, like super muscular, and the coverall doesn't go all the way? Would you double layer it, or what would you do?
If the coverall doesn't what?
Like fit all the way over the injury, like this way?
You just make a wider piece,
Oh, okay.
right?
Yeah.
Use whatever you have to use, or use two pieces and layer them. You could totally do that. But that's why it's nice, like you get to roll whatever size you really need. But remember too, like the muscle strain, it's only gonna be one slip of the tissue, right? If they're avulsed, you're not putting them back in. But it's only gonna be a small component. You have to find that. And so sometimes you have to tell them, like, get up, and then they're like, it's right here. X marks the spot. And then put them back here, okay? Because it's not gonna be the whole muscle. That's the whole point of using, why it's so nice to have this tape technique, because you get to unload the one area that has the deficit. The rest of the muscle is still relatively working, right? So that's what's kind of nice about this technique. So again, I'm gonna do all the same things you've seen me do. Now I have to have bigger strips though, because look at how far I gotta get across that. So I'm gonna make sure these strips are a good size. I'm definitely gonna need more than that. go here. Here, I lift and pinch, I lay it down. Again, you're seeing now the crisscross. %50 to the one that went in the same direction. I'm pulling kind of taut as I lift up, pull across, up, across. You see, it should look like this nice, clean basket weave. Almost there. Okay, I'm done. Now I just have to lay my edges back down, re-anchor, okay, you get to decide, close the anchor from the top and bottom, okay? That's kind of how neat it should look, all right? From here, let's bring you to standing. Come down to the floor, yep. All right, let's talk about the hip spica first. So what you're gonna do, now, the hip spica, you have to make sure this athlete goes to the bathroom now, okay? Because it's gonna be tough, we're going over shorts and things like that. So some athletes play with the spandex underneath their shorts. And so this would be ideal. Remove these, go down to the underwear, tape, then they pull their spandex over the tape to secure everything. Okay, that's really the best way to do this. This is why in some sports, female trainers are with only female athletes and male trainers are only with male athletes for this one of the reasons why, right here. So if it's opposite, right, and you're female working with male or male working with female, you just have to make sure, like, send them to the bathroom, come back. If we're not in underwear, right, because if that is not appropriate, you tell them put their spandex on and we're going over the spandex. But now you're locked in. That's why you have to go to the bathroom, okay? So then they come back from the bathroom. You're getting them into this stance position. This leg kind of has to be back. They've got a lot of weight on that back leg. This one's just coming to me. If this is particularly for just this and they need support up into the hip, it doesn't really matter if I have them turn this leg. I'll probably have them straight away. If this is truly a strain with a hip impingement, then I might consider foot placement. What I might do is have them just slightly open, right? Because now I'm gonna lock them in slightly open. It's gonna block them from internally rotating and impinging more. And so that's where the angle might come into play, that we need to decide what is happening with the front foot. Is it coming in a little bit? Is it going out a little bit? And that usually depends. If there's a hip impingement sign and they really can't pick their leg up, I probably would consider something with the foot. If it hurts more opening, then I would close them a little bit so that they can still move, but they're going to be blocked a little bit in that end range opening. Okay, so let's just say, for the sake here. All right, so what we're gonna do, I'm gonna have you just hold your t-shirt. We're just gonna imagine, right, she's got, these are like the tight shorts, and then she'll put shorts on top of that. Okay, so let's do the hip spica. So with a hip spica, we're using a 6-inch ace wrap. This is gonna run out of room. Because she's so petite, I'm probably not gonna run out like if it's one of the guys, okay? Or just someone who's much bigger, a little wider here. So generally speaking, I'm gonna start kind of high, but you see I wanna cover my tape, right? I'm not gonna start down here, I'm definitely gonna run out of room. So I'm gonna start kind of high, and I'm gonna wrap around, and I'm gonna catch the flap. Do you see how now there's no flaps? Okay, in general, I think in your manual, I think I tell you twice around here, go to the hip twice around here, and then finish around here. Okay, so I feel like we're good. I'm coming right up now. I want to go around her sacrum, which is kind of where her waist is right now, her shorts are. Okay, I'm kind of pulling pretty taut. Can you feel that, Karen?
Yeah.
I mean, I'm not just unraveling it, I'm kind of pulling as I'm unraveling it. This takes practice. This is very much like an art to get this right. Now I'm going to come down her gluteal fold. I need to be just hugging that. If you go too high, this is going to roll down. So I kind of have to like know where that is. If this is a high adductor strain, I need to make sure I'm hugging as high into the adductor as I can. In particular, if it's an adductor, but we really want to hug as high as we can to support the hip. So I'm going to come really high, and now I'm going to come and finish. Now, this always finishes very awkwardly. I'm going to have you reach down and hold that in place for me. Yep. So now I'm going to take my light plast. Did we need pre-wrap for this?
No.
We did not need pre-wrap for this, okay? Not for an ace bandage. I'm gonna catch, do you see this flap that's sticking out? I'm gonna catch that first. Okay. Now, I'm gonna come around and I'm gonna make sure that I catch that flap. I got the next one. And now I'm going to the highest point in the adductor. So that sets me up to come right to the back side of the hip like I did before, yes? Think her sacrum. Twice around, down, right over the area of the injury. You see that? Hug the gluteal fold, just make sure you're right under it. And I'm done. Now, what this is going to do, it's going to feel like to her, it's going to feel like this is pulling her up into hip flexion. That's what we need. She's telling me it hurts here, I can't lift my leg, but now because of this springiness, I've really secured the hip in the socket, and now it's going to feel like there's an assistant helping her hip flex. That's what this hip spica is going to do. It really locks in the hip into the acetabulum, and it's going to facilitate the hip flexion. The last piece is why we like to put those spandex on over this, is because if her thighs touch, this will cause a rub and a chafe. So that's why we really like to be down to the underwear if we can, put the spandex on, and then her spandex are touching, right? And her thighs are not. If that's not happening in this case, and this is how this looks, I need to put some skin lube here and here to help with any possible chafing issue. Okay? So let's review this again. We did the unload. So now the area of injury for her is protected from underneath. After that, because she said I can't lift my, right? Because the femur crosses the hip and the knee joint, right? It's supposed to help with hip flexion. It's injured. So she's having a problem flexing her hip. We then took the high ace wrap here, wrapped it twice around, and we finished around here. Then you saw how I put the light plus just below, so that I attached it, part of it to her skin. Wrap as high as we can around the hip twice and finish around the thigh. Finish with skin lube if you need it. So now walk around a sec. Do you sense that, like, that compression? Yeah, it's like wanting to pull you up a little,
Yeah.
right? Okay, so for hip impingement, this is your option. You wouldn't necessarily need the unload underneath, right? If it's truly just an impinged hip, they just need this part, okay? If it is a quad strain and they have it where it's affecting the hip flexion, you might require both. If it's an adductor, a hamstring, or a quad, anywhere below like this sort of high range, you could just get away with, as long as they can still hip flex, you can get away with just an unload and a wrap, okay? So let's do this leg. Put that one, yep. So let's just pretend I did that, right? Here was my unload. I already had it done. Or maybe here was my unload, okay? You have all areas that are usually in, you know, twisting, cutting sports. You're gonna get adductor strains and you're gonna get quad strains. You might get some calf strains. Running, you might feel hamstrings, right? If the hammy goes. So if it's just like this lower section, but she can still hip flex, or it's an adductor, she can still hip flex. Hamstring, she doesn't need anything at the hip. We're just gonna say we'll have done our unload, we'll spray, and I will just do, can you lift your shorts for me one sec? High as they go, good. We will just do it like this. So, pull, wrap around, pull, wrap around, pull, pull, and then last one. I'll finish laterally or somewhere in front, and that's what that looks like. Okay, so it could be where we don't need the full hip spica. If it's an adductor, where did I put this? And it's like this is my unload, well then my pre-wrap goes around here and my light plus goes up, and we try to have a little skin up there that we grab with the light plus. You just have to be careful with the fold in the back of the glute, that you're paying attention as you're coming around. You're kind of just under that fold so it doesn't roll on them. Does that make sense? Okay, good.
If it was a high hamstring,
Uh-huh.
is there any way to do it to help prevent or promote extension of the leg instead of flexion to kind of offload the hamstring?
Well, if it's a high hamstring, turn around for me, the only difference really is you're on the belly.
Mm-hmm.
You are finding your X marks the spot, right? You'll unload and you'll likely just wrap like this.
Okay.
You wouldn't really do like a reverse of this.
Okay.
Because usually, again, remember it's only a small portion of the muscle. The rest of the muscle is probably still intact and working. It's just you're gonna take away the strain right through that area that's the most injured. And it's surprising just doing the unload how much better they feel moving around. You can really have the athlete be pain-free just with the unload. Why we like to add the wrap is because we want to support the rest of the muscle. It's all under injury. It's just there's one area that's really the most injured, but you want to support the whole rest of the tissue. So I'm not a big fan of just having them go out with the unload if I know I can wrap here. Now that being said, there's one area, well there's a couple areas. There's the abdominal. If you unload the abdominal, you're probably not gonna do a full wrap around like the corset like we used to do like 30 years ago, because they're not gonna be able to move. You're just gonna unload them. If it's a pec, you really aren't gonna wrap around here. You're just gonna unload them. And so in those instances, we would do the unload, and then we would take the cover roll and put a bigger piece to really anchor it down, to make sure it doesn't pop off when they play. So those areas where, like if it's a bicep, you could totally do an unload and a wrap, right? These free areas get the wraps, but there are certain areas you just can't, okay? So yeah, the long answer is with the posterior side, you're not gonna bias extension. You just need to probably do your unload and your wrap, and you probably should be okay with that.
Okay.
Should be able to play with it. Depending if, you know, how severe the injury. If it's a grade 1, I'm probably gonna send most athletes back in if they can. They have to let pain be their guide, but most grade 1s with this can play, right? It's all dependent. It's like the championship game versus just a regular game. You start weighing, like you have to think longevity. Like what's the goal here? Is it to play today or is it to play in the final game? You know, so that's where you kind of have to try to help make the decisions for these athletes, because they're always thinking, I have to play, I have to play, I have to play. Like you don't have to necessarily play today. If your championship game, if you're being recruited and your scouts here, okay, that might be a little different. Things like that. If it's the Olympics, probably going to tape the athlete and keep them going. So you have these as long as it's safe, always as long as it's safe, right? If you can tape them. That's where taping is so powerful, because you can be pain-free in play. Okay, so let's each practice